know the fetal circulation, which is shown on this page, that's page 790 in the book, figure 21.3. Make sure you know, like, hold on a second. Make sure you know all the things like in these little tan boxes here. These are the 5 fetal special blood vessel things, or I should say special modifications that the fetus has. Basically, the purpose of all of these things is to make sure that the fetus is not wasting its blood flow on organs that it is not using yet. So, for example, up here in the lungs, you have the foraminal valley, and you have the Ductus Arteriosus. Okay, those are. Sorry, I know there's a bad glare there. Hold on a second. There we go. The foraminal valley, the Ductus Arteriosus, those are 2 ways that allow the baby's blood to basically go straight from the right side of the heart to the left side and bypass the lungs. Make sure you know their names, where they're located, and then what they become after birth. So after the baby's born, these guys essentially fill in and become blocked off. The Ductus Arteriosus changes and becomes a little thing called the ligamentum arteriosum, just shown right there. The foraminal valley becomes blocked off and becomes something called the fossa ovalis. Okay, that happens after birth. Some other changes to see down here: the umbilical arteries, and the umbilical vein. The umbilical vein is called the vein because it's taking blood towards the baby's heart, but it's a weird one because it's taking oxygenated blood, so that's why it's shown in red here. So here's the placenta, fresh oxygenated blood, or I should say the fetus's blood picks up oxygen, and then it heads back to the fetus via the umbilical vein. As it then goes into the fetus, the umbilical vein takes a little bypass route, something called the Ductus Venosus. The Ductus Venosus is a way to essentially go straight through the liver, bypass any of the actual tissue in the liver, so you're not wasting your blood flow on the liver. Okay, the liver's not really active yet in the fetus, so the Ductus Venosus is a way to bypass the liver tissue. You go right through it, goes into the inferior vena cava. Then you go into the right atrium. Out of the right atrium, the blood goes into the right ventricle. And then while it's in the right atrium, it's kind of tough to see on this picture, but that's where you'd encounter the foraminal valley, which would allow blood to go straight from the right atrium into the left atrium. Also, as the blood starts to go out through the pulmonary trunk, that's where you would encounter the Ductus Arteriosus, that again allows blood to basically go from the pulmonary trunk straight into the arch of the aorta, and that would bypass the lungs. After the blood gets pumped out to the baby's body and used, the used blood gets sent away from the baby's body via the umbilical arteries. Again, they're called arteries because they're moving blood away from the baby's heart, but they happen to be blue because they're taking deoxygenated blood away from the baby's heart. Okay? After birth, the umbilical arteries become ligaments that fill in that are called medial umbilical ligaments. The umbilical vein becomes filled in and is something known as the ligamentum teres, or it's also known as the round ligament. That's another name for it. The Ductus Venosus becomes filled in and becomes a ligamentum venosum. So, I think if you know so these are the 5 changes. If you know them and you know what they are and what they become, you should be in good shape. Just make sure you spend some time looking at that picture.